Good afternoon. Welcome to the 5th International Webinar of 2022, organized by Pets and Clips by Advance. My name is Alba Martos. I'm the International Vet Manager in Affinity Pet Care, and today we are here with Xavier Roura to talk about chronic renal disease in dogs. Good afternoon, Xavier.
Good afternoon, Alba.
So before starting, I would like to present Xavier. He's an European diplomate in small internal medicine, and he also is a member of the International Renal Interest Society, and he's also working nowadays in the hospital in the University of Barcelona. So before starting, I would like to remind you or to encourage you to ask any question you have in the YouTube chat you can see in the screen. And also remember that you can download the presentation clicking on the link you can see below in the YouTube description. So I will not delay any longer and we'll start the presentation. And first of all, I would like to ask you, Xavier, why do you think that it's important to talk about chronic renal disease in dogs?
It's very interesting to talk about chronic renal disease in dogs because usually as clinicians, we try to treat or to manage all the dogs with chronic kidney disease in the same way. And we need to understand that each dog in different stages needs different management. So this is important and we will like to talk during this session about this.
Okay, thanks. So, one thing that it's quite important is the diagnosis of the disease. So I would like to ask you the first question that it's about what has changed in the diagnosis of the chronic renal disease in dogs?
Well, when we talk about diagnosis, we can understand that the final objective doesn't change. So at the end, we are talking about a chronic disease, and this chronic disease is also progressive. So our objective as a clinician is try to make the diagnosis as early as possible, in the sense that we can treat and especially we can decrease or slow the progression of the kidney disease. But if we talk about how we can obtain this objective, these have changed. And now in the last years, in the last 20 years, have changed two important things. For one side, we have new methods or new tests in order to do this early diagnosis. And second, we increase to talk about the importance to make a good staging before to start the treatment. So it's not only an early diagnosis, then we need to do a staging before to start with the treatment. So when we talk about early diagnosis, there are two tests that now are very important. One of them is a classic, that is the measurement of proteinuria, and the other is quite new and is the use of SDMA in the sense to use together with the creatinine in the sense of make an early diagnosis than before. This is true because with these two tests, measurement of proteinuria and the measurement of the SDMA, could do this kind of early diagnosis. And so at these times, very early chronic kidney disease is possible to have a diagnosis in dogs. Then are important, and the changes are in the staging, because in the staging, in general, we have talked about only the values of creatinine, but now we know that this combination together with SDMA could give us a better diagnosis, but also a better staging of the dog before to start with the treatment. And moreover, we have also a change in the staging classification when we talk about creatinine, where we have decreased the size of the stage 3. So at this time, stage 2 in dogs go from 1.4 of creatinine to 2.8, and this similar to in cats, and this is a new staging of this part of the classification of the chronic kidney disease before to start the treatment.
So you have talked about SDMA. So how has it changed the diagnosis of the chronic renal disease?
Well, the use of SDMA have increased the quality of the diagnosis of chronic kidney disease. In the sense, for one side, is an early diagnosis, and furthermore, is a new test that could help us to do a better staging. When we talk about SDMA, we need to understand that SDMA is not depending of the muscle different to the creatinine. This is important, especially in the when wards the chronic kidney disease in general produce a decrease in the muscle, and this produce sometimes a decrease in the value of the creatinine, and this problem doesn't appear with the use of SDMA. So it's better in order to classify these dogs in more advanced stages. Second is also make a good measurement of the glomerular filtration rate, because we can make this diagnosis earlier than not with other kinds of tests. For example, with creatinine, we also measure the glomerular filtration rate, but you start to obtain some changes in this value when we have more than 80% of the kidney affected. When we use the SDMA, we can obtain this better diagnosis just with only 30–40% of this alteration in the kidney. However, SDMA needs also the use of this test together with creatinine, because we need to evaluate both at the same time. We need to remember that SDMA could change also with the presence of other diseases. Any disease that could produce a decrease in the glomerular filtration rate could increase the SDMA. So in some dogs, we can have, for example, hypoadrenocorticism, or we can have a kind of decrease of the glomerular filtration rate. For example, a decrease in the perfusion of the kidney could have an increase of the SDMA without a real kidney disease. And finally, we need to understand that these normal values are values for, in general, all the dogs, but the size of the dog and even the breed of the dog could change these values. So the normal values need to be sometimes more evaluated for the veterinarians, and need for clinicians use the SDMA, but together with other tests, like, for example, the creatinine. So in general, SDMA improve the staging and the diagnosis of the chronic kidney disease, in the sense that could add to the creatinine, we could add the SDMA and make a better classification of each one of these stages. So in stage 1, not only evaluated the creatinine, we also evaluate the SDMA, and we can produce different stagings, but using both tests at the same time. So can help to the veterinarians. Sometimes when you have difference between one value and the other, make this difference could help to the veterinarian to know which is the real situation at that moment.
Okay, so thanks. I think that it's quite clear, but if we talk about diagnosis, the next question is how important is urinalysis in this diagnostic of renal disease?
Yeah. When we talk about diagnosis, we say that SDMA and probably proteinuria are the more early diagnostic test. However, urine is very important because it's the result of the function of the kidney. So, of course, the evaluation of the urine gives us a very important information in order to decide if we have kidney disease and also which kind of kidney disease we can have. It's true that urinalysis, especially the evaluation, for example, of the urinary specific gravity, can give can give us differences in the diagnosis. So when we want to evaluate the function of the kidney disease, we obtain a decrease of the urinary specific gravity when the kidney disease is more advanced. So it's not a very early marker, but if we use the urine with, in general, urine from dogs during the morning and fasting dogs, if we can do the test, the urinalysis, usually 30 minutes after the obtention of this urine, or if not, we can maintain in the fridge maximum 12-24 hours before to do this urinalysis. And before to do this urinalysis, you need to put this urine to room temperature in order to avoid different changes or mistakes that could give this information of the urinalysis. So urinalysis is important. When we talk about urinary specific gravity, it's true that it's not an early diagnosis because we have these changes when about 70-75% of the function of the kidney have decreased, but give other kinds of information. For example, if we obtain a urinary specific gravity less than 1008 during different measures, we can say that is not a kidney disease. So we need to understand that to maintain the urinary specific gravity below this number means that the tools works and have the possibility to make a dilution of the urine. So they give usual information, so we need to do always a urinalysis. Especially when we talk about proteinuria. Proteinuria, we have said before that is very useful in the sense that it's an early diagnosis of the chronic kidney disease. And the urinary specific, urinary dipstick is easy, is useful, and also is cheaper. So for veterinarians, could be interesting to use this urinary specific test. Why? Because proteinuria could be look like a screening. So if we have a negative result when we talk about proteinuria in the urine, we can exclude the proteinuria as a test or as an early alteration that we can find in the chronic kidney disease. So it's interesting the use of the urinary dipstick in the sense that do you have a negative result, because we don't have false negative, means that independently of the urinary specific gravity, we are sure that there is not proteinuria. When we have a proteinuria, when 2 or more than 2 crores of the urinary dipstick, always we have proteinuria, but we need to do an UPC, urinary protein creatinine ratio, before to know the quantity of this proteinuria. And finally, if we have just 1 cross of urinary specific of the protein in the urinary dipstick, probably we will need the urinary protein creatinine ratio not to measure the proteinuria, if not to decide if we have proteinuria or don't have proteinuria. So with urinalysis, not always we need to do always a urinary protein creatinine ratio. Sometimes we need to do this, but sometimes only with the urinary dipstick is enough. But when we need to do this urinary specific urinary protein creatinine ratio, we need to know that in dogs, proteinuria is a value of more than 0.5 in urinary protein creatinine ratio. When we have a value of between 0.2 and 0.5, we have a borderline proteinuria that we will explain later that is not treated in the dogs. And finally, when we have a urinary protein creatinine ratio below 0.2, we have a non-proteinuric dog, and this is important because the staging is different and the treatment will be also different in these dogs. So urinalysis is an important part, a specific especially with the evaluation of the proteinuria for the early diagnosis and later for a good classification or good staging in the chronic kidney disease.
Okay, so we have been talking about diagnostic, but and also have you told us a little bit about the staging of the disease. So my question now is if all stages of the chronic renal disease are treated in the same way, or do we have to treat them in a different way?
Well, this is very interesting in the sense that in general, when we talk about chronic kidney disease, we talk about, okay, the kidney doesn't work very well and we need to treat. We need to understand that chronic kidney disease cannot cure. So our objective is try to decrease the progression of this chronic kidney disease, but we cannot cure this chronic kidney disease. So not all the dogs, depending on the staging, we will need the same treatment. And it's important to use only the treatment that are evaluated in each stage, because if not, if we make more complicated the treatment of the chronic kidney disease for the owner and also for the dog, more difficult is to obtain better compliance. So in this sense, it's important to treat each dog from different way. So although we have just 3 potential treatments, etiological treatment, nephroprotective treatment, and support treatment, the difference of each stage of chronic kidney disease, it is 1, it is 2, it is 3, or it is 4, is not in the type of treatment, if not if it is more interesting or not use this treatment. For example, if we have an early diagnosis, so we have a dog with a chronic kidney disease in stage 1 or stage 2, we don't need to use support treatment. In general, this dog has only polyuria polydipsia, but have not other kinds of problems. However, when we talk about a dog, for example, in stage 4, it's very important the support treatment, because in this period usually the dog have vomit, or usually the dog has hyporexia, they don't eat adequately, or sometimes have dehydration. So we need other kinds of treatment. So the treatments are the same, but each stage need different treatment. Finally, when we talk about the treatment of each stage, we know that stage 1, the beginning, needs different treatment that change with the pass of the different progression of the chronic kidney disease, and sometimes we will need to use other kinds of treatment when the progression is higher. For example, we need more support treatment than not nephroprotective treatment in the stage 3 and stage 4. On the other hand, in this stage 1 and stage 2, is very important the nephroprotective treatment, but is not important, or is less important, the use, for example, of the support treatment.
Okay, thanks. So talking about the treatment, I think that maybe we have to consider the diet that we give to this kind of dogs. So my question now is if we have to use a special diet for them or not. What's your opinion about that?
Of course, the diet is part of the treatment, but diet in the chronic kidney disease in dogs is always useful. It's the treatment that have the evidence-based medicine grade 1, so it's a very excellent results obtained in the progression or in the control of the progression of the chronic kidney disease has been obtained with the diet. So renal prescription diet or kidney prescription diet is very important in all the stages, in stage 1, stage 2, stage 3, and stage 4. So always we need the use of a diet. But of course, this diet is very interesting for different situations in each stage. For example, in stage 1 is very interesting because they can control proteinuria. So it's very important the use of chronic or renal prescription diets in this situation in stage 1 to control especially the proteinuria. More advanced is the the staging, more progressive have the disease this dog, we need other peculiarities or characteristics of the renal diet in the control of the chronic kidney disease. For example, more advanced the progression of the kidney disease, we need other peculiarities of this kind of diet. For example, is good as a nephroprotection because decrease the proteinuria, but also maintain, it's very important, maintain the body condition score in the progression of these dogs with kidney disease, but also is very important in the control of phosphorus level. This part is very interesting because in general, many clinicians use for the control of the phosphorus, use the phosphate binders. But at this time, the most or the best treatment for the control of the phosphorus in chronic kidney disease in dogs is the use of the diets. So the objective in the phosphorus, the level objective in each situation, clinical situation, stage 1, stage 2, we talk about 0.5 milligrams deciliter of phosphorus and 5 in stage 3 and 6 in stage 4. This objective could be obtained just with the use of a chronic renal prescription diet. When we cannot obtain these results with the diet is when we need to add a phosphate binder, but not before. First, treat with the diet. So diet is very important, but no need to forget this slide. When we talk about the treatments are always the same, but change the importance depending of the stage of the chronic kidney disease. Here, the diet is a nephroprotective treatment. So it's very important in stage 1, stage 2, and stage 3. But remember that in stage 4, probably it's more important that the dog eat, not what kind of diet. Important, eat. And then, when the dog improves clinically, could be most important to add a renal prescription diet. But at this time, in stage 3 and stage 4, is more important the support treatment. So rehydration, treat the vomit, so try to improve the quality of life of the dog and try to eat anything. Then, when I start to eat, it's important to start with the nephroprotective treatment, in this case, the use of the diet.
Okay, and also related with the treatment, do we have to use ACE inhibitors to treat the disease, or it's not so important?
Are very important, this kind of drugs, especially the angiotensin converting enzyme inhibitors is one of the best known drugs in the treatment of the chronic kidney disease. However, at this time, with the publication that we have about the control or the management of the chronic kidney disease in dogs, probably there are only 2 situations where it is important the use of the ACE inhibitors. In this situation, probably we need to use this when we have proteinuria, independently on the stage 1, stage 2, stage 3, or stage 4. We need to treat the proteinuria. The use of the ACE inhibitors is important, but only when we have proteinuria. So when we have more than 0.5 value of urinary protein creatinine ratio. The other situation where it's important in chronic kidney disease the use of the ACE inhibitors is the situation of the systemic hypertension. When we have systolic hypertension, that is quite frequent in chronic kidney disease, independently of the stage, we need to use also the ACE inhibitors, sometimes with other kinds of drugs, but is one of the situations together with the proteinuria when we need to use these angioconverting enzyme inhibitors. But it's very important in the both situations, the drug. So the dosage of these ACE inhibitors need to be 0.5 milligrams kilogram twice a day, in the sense to obtain this help in the control of the systemic hypertension, and this help of these drugs in the control of the proteinuria. So it's a very important treatment, but similar with the diet, we need to understand that is a nephroprotective treatment. So the AC inhibitors is interesting the use in stage 1, stage 2, and also stage 3, when we have proteinuria or hypertension, but it's less important their use in Irish 4. So in Irish 4, we can use them, but probably you need to use, or it's more important to use in this stage, other treatment like support treatment, because in this situation, the progression of the kidney disease is high, so we need to improve the quality of life and then try to improve the situation of the situation of the function of this kidney.
Many thanks, Xavier. So the next question is about how to manage proteinuria. So maybe can you give us some advices about that?
Well, proteinuria is one of the first markers that we have when we need to decide if a dog have or not chronic kidney disease, because in general, most of the dogs have glomerulonephritis as a most frequent kidney lesion. So glomerulonephritis means that the glomerulus is affected, and when the glomerulus is affected, we have this loss of protein in the urine, so we have proteinuria. So proteinuria means that early diagnosis, but also the progression of the kidney disease is one of the most important factors in the progression of the kidney disease. So together with the hypertension, we need to control hypertension and we need to control proteinuria, because if we have a stage 1, for example, or stage 2 of chronic kidney disease, and we don't control these two factors, the kidney disease progresses. So it's very important the treatment of proteinuria. In this sense, we need to use always treatment for proteinuria independently of the stage, because we need to evaluate just proteinuria, not when the dog has borderline proteinuria or non-proteinuria. Different to the cats, cats also need treatment in this situation, in borderline proteinuria. However, dogs only will be treated when we have proteinuria. With proteinuria, independently of the stage, we need to treat. In this situation, the best treatment is diet. So renal prescription diet could be the best treatment and the first treatment that we need to use in front of proteinuria in a dog. After 1 to 2 months with the diet, if we cannot control or decrease this proteinuria, or we cannot produce that this proteinuria became from proteinuria to borderline proteinuria or non-proteinuria, we need to add other kinds of drug. And the second more common drug that is useful in the treatment of proteinuria, always together with the diet, is the use of the AC inhibitors, always at this dosage, 0.5 milligrams kilogram twice a day. If after the use of the diet, renal prescription diet plus the AC inhibitor during 1 month or 2 months more, we cannot control this proteinuria, or we cannot decrease enough this value of the urinary protein creatinine ratio, we can add or we can change for the use, for example, of the fatty acids, so the use of 80 milligrams kilogram a day of the fatty acids of the omega-3 in general could be interesting also in the treatment of proteinuria, together with the diet, renal prescription diet, and sometimes together with the ACE inhibitor, other times just without ACE inhibitor, or we can use other kinds of drugs, for example, the angiotensin receptor blockers. Angiotensin receptor blockers could be very interesting in the control, especially the use of telmisartan, 3 milligrams kilogram once a day could be a good drug to control, together with the diet, or together with the diet plus the ACE inhibitor in the control of the proteinuria. And telmisartan could be probably the best drug of the angiotensin receptors blockers. At minimum, in human medicine, looks like telmisartan is more effective in the control than not losartan in the control of the proteinuria. So probably could be the best option, the use of telmisartan in this situation of control of proteinuria. Finally, when we talk about the control of proteinuria, we need to remember that most of these dogs with proteinuria have hypoalbuminemia. When we maintain the albumin in blood less than 2 grams per deciliter, we need to use some other treatments in order to protect the dog of the development in these dogs of thrombus. So we could be interesting when in 1 or 2 controls maintain this hypoalbuminemia, we can use these kind of drugs in order to decrease the aggregation of the platelets, like acetyl salicylic acid or copridogrel in the use of dogs with these dosages in the control of this hypoalbuminemia, the control of the development of this thrombus in dogs. So in general, proteinuria is one of the most important parts that we need to treat when we treat the chronic kidney disease.
Okay, let's move now to another question related with the treatment, and it's about gastric pH modifiers. So do you think that they are needed in the treatment of chronic renal disease?
Well, these kind of drugs, the pH modifiers, are frequently used by veterinarians, by clinicians, and probably is one of the most important myths that we have when we talk about the management of chronic kidney disease in dogs. First, we need to understand that the use of these kind of drugs is like just a support treatment. If it's a support treatment, we usually in IRIS 1, IRIS 2, and probably IRIS 3 usually are not necessary. So these kind of drugs probably are only useful in some dogs when they have a chronic kidney disease IRIS stage 4. Second, we need to remember that when we have chronic kidney disease, it's very infrequent in dogs and also in cats the presence of ulceration or erosions in the stomach or in the gastroduodenal tract. So if this situation is very infrequent, means that it's also very infrequent to find severe gastrointestinal bleeding or vomiting induced by a severe esophagitis. So these situations are very infrequent in dogs and cats with chronic kidney disease. So this means that we will use only pH modifier, for example, famotidine, omeprazole, or sucralfate, only in very special situations. So each dog with chronic kidney disease not need a pH modifier, don't need gastrointestinal different drugs for the treatment of this situation that is not frequent in this kind of dogs. So only we will use when we have gastric mucosa damage and you confirmed this damage. In this situation are needed this kind of drugs. So in most of the dogs we need only antiemetics. So we need to treat the vomit, not need to try to treat this other kind of lesion because are very infrequent in chronic kidney disease. In chronic kidney disease, in advanced stages, final and stage 3 and stage 4 is more frequent the nausea and the vomits. And in this situation, nausea and vomit, we need antiemetics. So we need maropitant or metoclopramide in different dosage or in different ways. So oral, intravenous, subcutaneously, we can use this kind of drug in different ways. So could be very interesting in the treatment as a support treatment, but not the pH modifier. So in general, we need to avoid the use of omeprazole, the use of other kinds of pH modifier when we have chronic kidney disease in dogs, and also in cats, but today we're talking about dogs, so we need to use these drugs just in very short or very in very a group of dogs that have only this kind of lesions in the stomach or in the duodenum.
Okay, I think it's quite clear. So let's move to the last question about diagnosis. So is a renal biopsy needed, or when it's needed, when it can be useful to detect the renal disease?
When we talk about the use of biopsy and we talk about chronic kidney disease, in general, we also think with kidney biopsy, because it's true that in general biopsy gives us the real diagnosis, what is happening in this kidney, and probably is the only way or the only exact way in order to give a perfect treatment for this situation. However, we need to understand that chronic kidney disease is a progressive disease, so we cannot cure. So probably is not useful in all the dogs with chronic kidney disease. In some of the dogs with chronic kidney disease could be useful. So the problem of the use of the biopsy in chronic kidney disease is the potential limitations that we have. So we can use the biopsy we cannot use in advanced disease. So when we have a progressive kidney disease and we are on a stage 3 or stage 4, the biopsy could not help to us because it's progressive, this disease, so we cannot do nothing more in this kidney. Or is not useful, for example, for a classification, because it's not easy make a clear classification of these lesions, histopathological lesions. So each pathologist can give us a different diagnosis, and sometimes the classification is different, so at the end we don't know exactly what is the best treatment. And sometimes we also have that this classification, histopathological classification, is not associated with a specific treatment. So sometimes different histopathological situations give the same treatment. So at the end, the usefulness of biopsy sometimes is not clear. And finally, we need to remember that in general it's safe, but sometimes we have problems when we do this procedure. So at this moment, probably when we can do or is necessary in chronic kidney disease is necessary the use of biopsy. Could be interesting, for example, when we are treating proteinuria in not advanced, so in the first stages, stage 1, stage 2, beginning of stage 3, but in general, stage 1 and stage 2, if we have proteinuria and with the treatment of proteinuria we can obtain good results, probably could be a potential interesting for the diagnosis and for the management of this dog, the use of biopsy. Or, for example, when we have an increase of the size or we have different kinds of masses in the kidney, because we need a diagnosis of inflammation or a diagnosis of neoplasia, and it's not the same a chronic kidney disease associated to neoplasia or associated to an inflammation. Or could be interesting when we have hereditary kidney disease. So we need a diagnosis because we need to understand if this disease in the kidney could be transmitted, so could be familiar, so it's interesting for the use of these dogs later as, for example, for breeding. And finally, could be interesting in acute kidney disease. So in acute kidney disease that could be cured, it's very interesting to know what is doing in the kidney, because sometimes to know exactly the lesion in the kidney could help us to use the best treatment so we can cure. but in chronic kidney disease is not useful, especially when chronic kidney disease is advanced stage of chronic kidney disease. So in stage 3 or in stage 4, it's not useful because it doesn't change nothing. So we know the final diagnosis, but the treatment would be the same. We cannot change the progression, so we cannot cure this kidney, so we cannot do nothing better in our treatment for this dog.
Okay, so let's move to the last question. So okay, we have we have done the diagnosis of the dogs. We are treating them, but how often do we have to check them?
The follow-up of the dogs and cats with chronic kidney disease is basic. So it's important because we start with a kind of treatment and we maybe need to change this treatment, or as I explained in the first part of this presentation, the treatment will be different in stage 1, in stage 2, in stage 3. Will be different if the dog is in stage 3 but have proteinuria or don't have proteinuria. So different situation means different treatment. So the evaluation of these treatments and the evaluation of this progression is the sense or the meaning of this follow-up, of these checks. So are very important, but in dogs are difficult if you compare with cats, because in dogs the progression of this kidney disease is quite more difficult to predict this evolution. In cats, in general, the progression is quite constant. So we know more or less how many times will be this cat in this stage and when move to the second stage, and so when could be necessary or could be probably necessary change the treatment for these different stages, because we know better the progression of the kidney disease in cats. However, in dogs it's more unpredictable, so we cannot predict what could be the progression. So we have rules, we have recommendations, but in dogs sometimes we need to be more, the clinician need to decide if one dog or in another dog maybe they need to do a different follow-up. In general, the rules are when we have a dog, a diagnosis of the dog of the chronic kidney disease in stage 1, in general could be enough a control every 6 months. Because in general, in stage 1, we have only sometimes hypertension, or usually, in some dogs we have proteinuria. So when we have proteinuria, hypertension in chronic kidney disease, but we don't have azotemia or changes in the SDMA that produce another stage, could be enough control every 6 months. However, when we have a more advanced stage, we need to shorten the time between controls. No? And this sense, in stage 2, probably a good recommendation could be every 4-6 months, could be interesting, but always remember that dogs are less predictable than cats, so sometimes, depending on the dogs, could be interesting to do a shorter control before to start with this kind of controls, or to maintain these follow-ups at this every 4-6 months. In stage 3, the chronic kidney disease is more advanced, so we need to work with more close work with the owner, in the sense that make a good control of this dog, and probably do a control every 2-4 months. At least at the beginning of the diagnosis, maybe one every 2 months could be interesting, and later, if they maintain, the dogs maintain in this stage 3, probably a control every 2-4 months could be enough in order to evaluate if with this treatment is enough, or we need to do other kinds of treatment, or there is a progression of this chronic kidney disease. And finally, when we have a dog in IRIS 4, of course IRIS 4 or stage 4 is more advanced chronic kidney disease. the situation could be sometimes more severe. Most of these dogs have vomits, dehydration. Some of these dogs, sometimes they don't eat. So we need a more close control because it's a more severe situation. So in general, controls every 1-2 months, even sometimes shorter at the beginning, every 15 days, could be interesting in the follow-up and the control of these dogs with chronic kidney disease. So the control is very important, less predictable than in cats, so the recommendations are these, but we need to change probably as a clinician depending of the owner and especially depending of the dog that we are in from. So the recommendation could be a little different when we talk about this.
Thanks, Xavier. So, well, we are at the end, but before closing the session, I would like to ask you, because we have a lot of information, which is the main take-home message that you like to give to our attendees to remember?
Well, there are many different possible key points, no? And most of these key points has been explained in this presentation. However, probably the most important mission is to understand that the good control, the good management of the chronic kidney disease need an early diagnosis, need a good staging, iris staging, and finally these two things allow us to this a good treatment. And each treatment could be different depending of each dog and depending of each stage and substage have this dog. But the most important is when we talk about chronic kidney disease in dogs, the best treatment or the best treatment that allow us to decrease the progression of the chronic kidney disease is the use of renal prescription diet. So at this moment, probably this message, good diagnosis, early diagnosis, good staging, and adequate treatment could be the best option and the best, most important message for the clinicians.
So thanks. I think that it has been really interesting. So we are at the end of the session. Just keep connected because we have received some questions in our chat, and we will connect in 3 minutes. Thank you. Okay, we are here again. So as I said, we have received some questions for you, Xavier, but before starting, I would like to remind you that you can download the presentation clicking on the link you can see below in the YouTube description. And okay, let's start with the first question. The first one is a vet that she's asking that if we have a patient with a value of 18 in the SDMA, but the creatinine is normal, can it be considered stage 1 or not?
Yeah. It's not an easy question to answer it in the sense that SDMA have a tremendous value, but as I explained earlier, we need to use both creatinine and SDMA. But we have this discrepancy between the result of the creatinine and the result of the SDMA. In general, if we repeat these both values and maintain this alteration after 1 month, for example, 3, 4 weeks, 5 weeks, we repeat these values, and both maintain an SDMA in 18 and a creatinine in a normal value, in general, it's accepted that this dog is in early stage of chronic kidney disease and probably is in stage 1. So, in general, both are necessary to make a diagnosis and to make a good staging, and sometimes both could be complementary, but when we repeat and maintain discrepancy, in general, is more useful to follow the stage that is adequate to the value of the SDMA.
Okay, thank you. So let's move to the second one, and it's about what do you think about the routine control of the SDMA in all dogs?
In SDMA is very interesting, but is not perfect. It's interesting in all dogs, in the control of the all dogs. The annual check health is very interesting to include the SDMA, but not just alone. Together with the urinalysis, together with the creatinine, together with the blood pressure. So we need to evaluate different tests or different values that could help us to decide if this dog start to have a clinical disease in the kidney or not. Only the SDMA alone not, so together with the other, yes.
Okay, clear. Let's move to the third one, and it's about what do you think about the bioregulatory medicine as an alternative to treat this chronic renal disease?
Well, with this kind of therapies probably are the future, no? And probably they will give us probably good satisfactions in the future, in the sense that maybe we could control better the kidney disease. But nowadays, at this moment, the publications, the evidence-based medicine associated to this the use of these techniques of the treatment of this treatment in chronic kidney disease in dogs are not enough in order to change or include them in the normal protocol that I have explained it as a treatment. Mm-hmm.
Okay, thank you. The next one is about the reliability of the machines that give us the values of creatinine of protein in the urine. What do you think about that? We can be confident of them, or we have to be careful about the results we have?
Yes, no, of course, in my talk, I have talked about the SDMA values obtained by IDEX lab. However, there is other kinds of labs and machines that could give us the result of the urinary protein-creatinine ratio. So you can use them and could be interesting, but in general we need to use a good evaluation of this urinary creatinine ratio. Mm-hmm.
Okay, let's move to the last one, and it's about your opinion about homemade diets to treat or to prevent this disease. What's your opinion about that? Do you think that it's better to use a homemade diet or a commercial diet?
In general, but this is in all the diseases, not only in the chronic kidney disease. The commercial diets are more stable, and we know perfectly the concentration. We know perfectly are very balanced. So in general, in all the diseases could be better the use of commercial diet and not in front to the homemade diet. Of course, each case is different, and perhaps in some dogs that could be not possible for the owner or for the dog for different reasons, could not be useful, or we cannot use the commercial diets. There is possible or it's possible to use a homemade, but need to be a homemade diet produced or designed by a nutritionist, a veterinary nutritionist, because need to have concentrations, different nutrients, different characteristics, especially for the treatment of a chronic kidney disease. So in general, use commercial diets, but in some cases it's possible to use homemade diets in chronic kidney disease, but need to be diets produced or created by a nutritionist.
Okay, thanks very much. We are at the end of the session. So thank you for joining us today. I hope you have enjoyed this session, and I hope to see you soon next month in the next webinar. Thank you very much.